Those numbers have climbed since September 19th when 269 people were hospitalized. 96 patients hospitalized with COVID-19 are in intensive care. That's up from 89 on Sunday.
Some rural Iowa hospitals could quickly be overwhelmed if COVID-19 hospitalizations continue to increase across the state. KCCI's Chris Gothner is live at Iowa Methodist Medical Center in Des Moines tonight to show us how bad it could get.
Well, typically rural patients with more serious COVID-19 illness would be taken to a bigger city hospital like this one. But folks in rural areas rural hospitals say that the rural hospitals could quickly become overwhelmed if hospitalizations continue to rise.
I think it could be the perfect storm.
Doctors are warning that Iowa's rural hospitals could be hit especially hard if COVID-19 hospitalizations continue to rise, especially as the flu season begins. Dr. Brian Melhouse chairs the Boone County Board of Health. He says a lot of rural hospitals have closed their ICUs, farming out care to larger hospitals, but an overwhelmed system could force them to try to reopen.
The problem with reopening the ICU is they might not have the ventilators anymore. And even if they do have the ventilators, they might not have staff trained and familiar with their use.
Melhouse says a lot of newly trained doctors and respiratory therapists may not be comfortable using ventilators. Up in Boone,
we could open our intensive care unit if we had to, but there's only 4 physicians who are comfortable running ventilators. If it came to that point, we have a disaster plan in place to be able to staff with enough respiratory therapists and nurse anesthetists to make it happen if we have to.
And an overwhelmed system could lead to elective surgeries being canceled again.
It's bad for patients in the first place, when they have to delay any type of surgery.
Something that would also devastate rural hospitals' bottom lines.
And a lot of rural hospitals are struggling greatly from the closure this spring and have not recovered.
And that also has long-term implications for those communities.
Now, ultimately, the doctors say it's up to the whole community to keep both viruses at bay, to keep any hospital from getting overwhelmed. Of course, that means social distancing, mask wearing when you can't, as well as hand washing, and of course, getting your flu shot.